Hi, this is Philip Mandelbaum with Customer Engagement Insider, and I'm really excited to have Brindha Sridhar here today. She's Senior Director of Customer Experience for MetroPlusHealth, and we will be talking about the future of customer engagement. I don't think there's many people out there who are more qualified to have this conversation with me. Brindha, you've been heading up customer experience for healthcare companies for almost a decade. Thank you so much for joining me. I look forward to picking your brain a little bit.
Thank you, Phil. It's such a pleasure to be here. Really excited to talk to you about a subject that's very close to my heart. I've been fascinated by how customers think, what we all think when we're making purchases, when we're moving companies, how we're actually making our decisions, including in healthcare, especially in healthcare. So I'm very excited to be joining you today to talk a little bit more about that.
Excellent. Thank you. And that speaks to exactly why I wanted you here. I think there's a lot that can be learned from healthcare specifically, but also specifically your passion for this, and even you touching on psychology without even saying it. Why we make the decisions we make is critical to all of this. Interestingly enough, before you did CX, you led media affairs, business model innovation, supply chain teams. And like with DEI, where we say they shouldn't necessarily be a DEI director when we hire them, we'll make them that. You probably learned a lot from those past experiences. One of our priorities at CEI is studying and showcasing this interconnectedness, whether it's CX and digital marketing in sales, CX in sales, how employee experience intersects with this, as well as ops, biz dev, and other business areas. Can you take us down that road a little bit? What from your past experiences have you been able to translate into your work today?
I love that question. I actually started off with my graduate degree in biological sciences, moving from mammalian cell culture and lab work all the way through to what I do today. It's been quite a journey, and I think the fascination for me is in how everything connects. A former CEO and mentor used to say, you take care of the customers and they'll take care of the business. I would go a step further and say, you take care of employees, they'll take care of the customers, and you take care of the business. That centricity goes into everything we do, whether that is in supply chain, in the lab, in understanding the experience of the customer, in medical affairs. And what I've been able to do steadily over my career is be able to make that connection to the customer. And I think people often feel the most motivated when they know whatever they're doing has an impact on something bigger. And that's one of the things that I like to do, be able to use storytelling to really show people what they're doing specifically is and how it's actually going to impact the customer's experience and the impact on the customer's life. And that's essentially one of my, I'd like to think, superpowers. I'm able to put myself in other people's shoes because I've worked in supply chain, because I understand the lead times, because I understand the burdens, because I understand what our medical teams are facing, because I've been there. So it's easy for me to be able to relate to them also while we're trying to work on this larger goal of improving the customer's experience and outcomes. Specifically at MetroPlus, as you're aware, we serve New York's underserved communities and marginalized populations. That really requires a full coalescing of our organization to be able to meet those common goals, because we have to come up with a lot of unique strategies to be able to support our populations. So to be able to do that, to be able to bring that broad level of consensus and broad level of alignment behind our strategies that relation to the broader goal, and that connectedness and that camaraderie, that becomes very important. And I feel like I'm authentically able to do that because of the experiences I've had.
Oh man, that was so well said. I could go in so many different directions. I'm going to start by saying that my wife works in healthcare, and she often says, in this hospital, I'm running wound care for this hospital, and this, but she does it from the medical side as a nurse. This person runs the same center from an administrative perspective. He or she, or they, I should say, does not have the medical background. And so my wife is often saying they can't relate to the nurses in the same way that she can. So just further exemplifying your point. And another thought I had was just, are you hiring for interns to just follow you around? Because this does translate outside of healthcare, and it also translates outside of populations in need. And the reason I would say they do is because of the complexity of the work that you're doing, and also the human interest and inherent corporate commitment to society that is part of what you do. A lot can be learned that can translate outside to maybe organizations that don't have to work with underprivileged communities, but maybe should, for instance. Really well said. Can you get into more detail about the types of information that you guys share, and how those conversations actually take place? Is it the role of a senior director of customer experience to sit down with marketing or sales? How do those conversations take place and get like filtered through the organization?
We probably are in a very privileged position of being very aligned around our goals as an organization. Most of us, all of us, are speaking from the same hymn sheet. And our primary goal is really being able to serve our customers and serve our communities at large. One of the things that I often use in being able to communicate is data. Data is at the heart of everything we do in CX. We use quantitative, but also qualitative data. We use a host of primary and secondary research methodologies to augment our understanding of our customer. And additionally, where consumer behavior is concerned, we do a lot of behavioral analysis that helps us get very pointed insights into what we can do to improve members' lives and improve customers' lives. That data and being able to share that data and that story and how it impacts the outcomes that a customer might have is probably the single most unifying storytelling platform for our entire organization. And when people see this information, there's a natural tendency to want to act to improve it. Another way that we do it is through customer journey mapping. We really feel that everybody understanding the pain points, not just of the customers, but of each member in the organization when they're trying to address that specific journey point in the customer's experience, is going to then help us see what is a medical person facing, what is a nurse facing, for example, what is the administrator facing when they're having to go through something. And oftentimes you'll see that the same point is where a lot of the issues are arising, but for very different parties. That then helps you to say, this is a problem area for everybody, let's go fix it. And I think when you start tying it to business outcomes, your organizational leaders then have the opportunity to really be able to support you in being able to make those investments to improve the processes and the systems around that area. So we do this very systematically, and we do this continuously. What it really helps, of course, to also break down organizational silos, of which there can be quite a few in healthcare, but also in other businesses. But I think being able to unify on a common set of metrics and a common set of data is really, really important, really powerful.
Yeah, really well said. And you touched on, I would say you kind of touched on organizational remodeling, another, kind of core area of expertise. And You also said this happens ongoing, continuously. Very important. None of these documents, strategies, set of tactics should be stagnant. Something that I recommend all the time, continually analyzing and improving, optimizing. Is organizational remodeling what we're talking about? Or is that something that you did when you came in? What was it like when you joined? What needed to be done? What were you able to achieve? And let's talk about that in relation to the way an organization is modeled and how that impacts the employee and the customer.
That's a great question. Many organizations, and some of my past experience, are still structured around traditional constructs of products and departments. But if we look past our silos, we're all working towards the same goal, serving the customer. We just go about it very differently. Being able to unify the organization and actually incentivizing the organization around common performance indicators and articulating this to the level of organizational objectives oftentimes really gives organizations the clarity towards greater collaboration. I've been in organizations where these common goals actually then translate to the shared bonus structure that you have for the year. So all of you are essentially getting a multiplier based on how you performed on this common shared goal. You could be from sales, you could be from medical, you could be from marketing, you could be from CX, it doesn't matter. But this then also allows employees to really very clearly see what those larger goals are that they contribute to, as I mentioned earlier. And I've seen organizations do this in different ways. Some people are able to do this at a much more micro level, start getting kind of buy-in and success and being able to demonstrate success and then go much broader. And other organizations are at the point in their evolution where they're willing to make those big customer facing changes where everything starts from the customer. So even in their titles, they have people that say, customer for a particular, I don't know, disease state, or a customer engagement person, whatever that may be. That level of detail between how it's executed across departments or organizations can vary, but I've seen it done well, and I think the criticality there is the data and the metrics and the goals. And I think when you can anchor around that, people are much more likely to flourish in a matrix environment.
And I think it's worth noting that, you're talking a lot about feelings, emotions, how your employees, what their lives are like. And then the same for the customer. And in the same breath, we're talking again a lot about analytics, KPIs, data. So the data is what enables us to have these better understandings of our employees and our customers. And I love the idea of, it sounds like you talked about maybe gamification when it comes to employees. There's also ways to gamify the customer experience. And then another thing I loved was the idea that I can't think of anything else that would bring employees more together and improve company morale more than a shared bonus structure where we have, instead of siloed KPIs, we have company-wide KPIs. And if we all hit them, we all hit our benchmarks, we all benefit. I love that idea. And, it's interesting. You also mentioned the stage of evolution of an organization. Let's talk about that. Digital transformation. I'm assuming that's part of organizational structure changes and more critical every year. Can you speak to that and how it relates to the customer experience?
I think Steve Jobs said, you start with the experience and work back to build the technology and not the other way around. And what would a conversation about CX be without Steve Jobs? But it's interesting, though, that I find a lot of organizations still do the latter. They're actually starting with the technology and trying to force fit the CX around it or the UX around it. And it just doesn't work because every organization is constructed differently. The rules and philosophies and guiding principles are different everywhere. So where it is possible, in some of the changes at least that we're making, we try to bring CX to the table much more earlier. So we're part of architecting what experience we'd like to create for the future. And then the UX and the digital piece around it is something that's anchored to ensure that those goals are met. The other interesting thing about digital experience that we talk about a lot in our organization these days is, you know, it's not healthcare to healthcare that we're competing against. Our baseline is now the Amazon and the Apple of the world. So it almost feels alien when you are living in that world as a consumer, and then you jarringly come out of that and you go into some app for health related activities that you're trying to use. And it's a completely disjointed experience, relatively speaking. But that relatively speaking is because our core experience is anchored around how easy things are to do when you have to buy something on Amazon. So we think about that a lot. We have to stop imagining ourselves as being this healthcare industry in this little microcosm. We're actually part of the bigger ecosystem, and our consumers have every right to demand that we do better in being able to make those seamless experiences happen. So digital offers digital experiences are here to stay, but it's not a one size fits all again. We have digital natives, we have all the way through to our older Medicare members, many of whom are tech savvy, but they're probably expecting some in-person connection. They're expecting some phone conversations in addition to your digital touch points. So you have to be able to cater to all of those groups. So it's not a one size fits all. You're also looking at trying to automate as many lo-fi digital activities and make them self-service as possible so that the really complicated concierge type solutions can be left for the more high touch needs of our members. So we try to really think about that. It's always a case of managing your workforce. It's a case of making sure the experience is right, still delivering to your goals. So we keep having to ensure that we're fine tuning what those expectations are. And again, data is a huge player in that because we get to see exactly what we're going to be able to automate and what we're going to have to keep as high touch as possible.
I love that. I mean, automating the things that may as well be automated and not automating what you called the high touch point. It seems so obvious, but a lot of organizations, business leaders are thinking efficiency, efficiency, efficiency. And as you said, by automating the simpler tasks, CX or support people are actually able to focus on more strategic or, ROI impacting responsibilities, right? Like having the harder conversations where you really need to demonstrate your understanding and your empathy. To that end, I think like empathy and understanding all your different target audiences, whether they're, senior citizens or whether they're just entering, your niche. CX is so critically important. That's why we're here, obviously. Someone told me recently about an idea at an organization where it's in and it's working. I'm curious about your thoughts. A CX university, so to speak. Part of your onboarding for every single employee is to go to the CX university so that no matter where you end up at the organization, even if it's in, I don't know, some IT thing that's pretty obscure, you still have that customer experience background. So you're always thinking from that perspective. Have you heard of that before? Any thoughts on that idea?
Absolutely. Interestingly, we actually have an intro during our onboarding to CX and our mission around CX, why it's important, how it impacts our customers, but also our brand and our organization. And a lot of people come in already thinking of the parameters that are important in our organization and why their role is critical in making good CX a reality. So, that being said, one of the things we're actually institutionalizing now is a model called Learn, which we call listen, engage with empathy, assessing the situation, resolving and navigating our members through healthcare. What this really helps us with is that common anchor for everybody when they're thinking about any customer facing decision. This is primarily for our customer facing teams, but it can essentially be used in any situation. So we work through kind of rolling out that training across the organization. The goal would eventually be to have that integrated into the early training and onboarding process as well. But in complement to that, one of the things that we are doing is rolling out a customer experience dashboard across the organization. So all customer facing teams actually get to see what the perception of the customer is of their team. So when I speak to all parts of our organization, we have a very distinct view of who is the customer sweetheart, who have areas of opportunity, and who the high performers are, and what is it that members and customers love about them. So that allows us this common language and this common thread in the way we speak to everybody. Because when a customer comes to MetroPlus Health, they don't care which department you're in. They care about whether you were at that day, at that point, help them resolve something that in many instances can be very critical. They're probably needing approval for something, for a test that they need for prevention. They're probably going to the ER for something. So it's ensuring that we're there for them and it does not matter which department you're from. So how do you also create that one unified voice of MetroPlus Health? The member or the customer should never have to think about or have to remember which department they spoke to. That's not their job. That's our job. So how do we make that happen for them? That's the goal.
Absolutely. And just to kind of hammer home how critical this is, 96% of consumers will leave a brand after one bad customer service experience. 92% will also call you out for it on social media. Any tips on, since it can't be avoided, even when you do it as well as it seems like you guys do, it happens. Someone has an off day at your organization, a customer suffers because of it. It can be that simple. How do you respond when it does happen? What do you do to counteract that?
We know we can't make everybody happy, but we sure do try. We focus on our strengths and we're aware of where we need improvement. So, let's start there, right? And then there are a couple of things that are critical to do right up front, especially around social media. One, be quick to respond. Make sure that you're acknowledging, make sure that you're authentically responding, and ensure that you're very clear that regardless of what the outcome or the investigation is going to yield, we're sorry that they had that experience. That was not our goal, right? And then what we want to do is really mobilize the internal forces to be able to investigate the issue and get back to our customer with potential solutions. We have a very robust process around this. We have our operational teams usually geared to respond to our social media queries. We have an internal mechanism. We come back with solutions very rapidly to our customers. If that is in the case of a call and they didn't actually, they left us maybe not a great review, but not on social media, we actually follow back with people who are leaving us low or poor ratings on our after call survey or such. It's not just because it's public, it's because it's right. So if we didn't do something, how do we make that better? Because ultimately you called us because you had a need. How do we make sure that we're actually serving that need and actually getting that 5-star rating from you? So that's our goal. We've had a very fortunately instances where if we've had negative ratings, we've gone in, we've resolved the issue. And of course, we would never prompt anybody to change the rating. They do that voluntarily. And we're very grateful for that. And we want to continue to strive to make that happen.
I have to tell you, I live in this area, and I kind of, for this purpose, wish I made less money because I don't get this experience. And I guess I'm paying more probably, right? That's really important what you just said. And our latest research at CEI showed us and shows all of us that a huge majority of companies are talking to their existing customers. A slightly smaller percentage are talking to prospective customers and leads. Nobody seems to be talking about customers, or talking to, I'm sorry, customers who are not happy and about to leave, or customers who are no longer customers. What can we learn from the bad experiences? And what kind of data are we deriving, and how are we utilizing this to improve future experiences?
We actually have a couple groups internally that work on just this. We look at all our complaints data, we look at our social media data, but we also look at the people that have unfortunately left us. And we have regulations on how long we have that we can contact them. So within that time frame, we actually reach out to these people and make sure that we understand why they left. And sometimes some of them come back because they didn't know that we could offer a service. A lot of it is actually lack of awareness. And that is a big area with the engagement part of the business that we work really hard to ensure that we're expanding the awareness of the services that people can avail of when they're on our plan. For example, for our New York City employees, it's the first time that we're offering free dietitian services. And we're the first health plan in the country to do that. We care about making sure that people are healthy and really know what good foods are that they need to be putting in their bodies to help nourish them. And it's services like these that we really try to go above and beyond to try and provide to our members. It's these services, if people don't know about them, they won't know that they can actually avail of them. So how do we make sure that that message gets across? And it's not just standard marketing. It's actually ensuring that the way you message to your members, the information is actually retained. In fact, I think there's some data that says you have to message to someone about 7 times for the information to be retained. How do you do it in engaging and meaningful ways that the information actually resonates? And there's information overload everywhere. How do you do it in such a way that members are actually capturing it and they're able to act on it? So that's stuff that we think about as well.
Wow. So let me first say that I could use those nutritional services myself. And I also want to say just how important it is that you're offering this to historically marginalized and, currently disadvantaged people, because it's like the opposite of what we think of when we think of medicine. We think of pharmaceuticals, treating symptoms or diseases. We don't ever imagine that those same people might be trying to help us fix the causes of our problems and preventative healthcare. That's a beautiful thing. How important are personalization and empathy and transparency and authenticity in these conversations, particularly when someone has left?
Yeah, I mean, you're not going to be able to solve for everything. There is a mechanism that each organization follows, and MetroPlus follows in things we're able to offer to our customers, and we pride ourselves on that. And we want to make sure that the people that are joining our health plan are able to take advantage of those services. And sometimes, if they decide to leave, we want to make sure that we are able to authentically, if there's been a fault on our end, if there are things that we could have done better and we didn't, we're sorry, but can we offer you some options? Are you still willing to, can we offer you options to improve your awareness of certain things? We actually started a escalation unit a couple years ago when I just joined the company. And this was before people were leaving, but they had expressed that they were dissatisfied with the plan and they wanted to leave. So this escalation unit, the goal was not to make these people stay. The goal was to say, just tell me what your problem is. Let me see if I can help you. And then if at the end of it, if you choose to leave, that's okay. We trust that you'll make the right decision for yourself. And we were able to retain about 76% of the people that had said that they wanted to leave, that they came in with that intention of leaving. It's not because we were trying to convert them. It's because we were only saying, allow us to show you the options. And then we understand this is not a ploy to kind of keep you. And it's important to trust.
Because of that. It's actually
Yeah.
because of that you were successful, right?
Yeah.
I mean, if people had felt like they were talking to a salesperson when they were ready to leave, they wouldn't even have finished the conversation.
Yeah, exactly, right. And it's important to know that you have to trust your customers to make the best decisions for themselves. We can arm you with information, but it's ultimately your decision. And we want to respect that. And that's the same for you or I. We all want to feel like we have that authority and the agency to make our own decisions, but we definitely want the information when we need it. So how do we become the conduit for that information? And then step back and let people kind of make the decisions they need to make. And that's the process we use with everything. We want to make sure that it's internal, it's with empathy. The empathy is in kind of engaging with the right information, engaging authentically, even with my colleagues and my peers, and ensuring that I arm you with the information, but then ensuring that you're able to take the next steps that you need to. That is the goal of everything we try to do in CX, and hopefully that kind of spreads in a cultural way across our organization, and hopefully within our kind of healthcare ecosystem as well.
Yeah, that would be nice. If some of this bled elsewhere. Oh, what a weird pun. That was unintentional. Okay, so you touched on storytelling a lot. That's how I perceive the work that I do as well. You also talked about information, someone needing to see something 7 times before finally it registering and staying in there. So we can probably have an entire other conversation about what marketing maybe can do better. But as it relates specifically to CX, I'm going to let you go soon, by the way, but how does this, is this kind of where the self-service portal kind of comes in? Like marketing maybe gets them there, but then it's more about the CX team engaging with the UX team to make sure that whatever else is needed is available.
Yeah, absolutely. If you are able to understand what the journey of the customer is when they first become your customer, a critical part of that is understanding what their early 30, 60, 90-day journey is going to be, and ensuring that you're building really meaningful connections in those first 30, 60, 90 days. Think back to, when you joined a new health insurance plan, what were the things that you needed? What you were looking for your ID card, or you were looking for I need to get test X, how do I go about doing that? Making sure that those early months in the member's experience are as seamless as possible, and the information is really accessible, and they know how to get to people as quickly as they can. If you're able to arm them with the right tools, if you're able to bring them to the places where they can get this information, how you gamify it through storytelling can be how you can actually engage them. We actually have onboarding tools that we use that are in a way gamified as an engagement tool and allow them to learn interesting tidbits about New York City while they're actually learning about their health plan. So we try to do things like that that would help members really engage with their health plan, because health and caring about health doesn't have to be boring. It can be entertaining. It can be as fun as you going out and buying your next iPhone. That gratification is something that we want to provide in health as well. So how do you do that and make it more meaningful and enjoyable for people? So that is, again, stuff that we try to do. And the easier you make it and the more engaging you make it, the less burden you will have to be present when those things happen, and it'll automatically become low touch, so you can again then go and focus on the high touch, high need part of the business, right, for your customers. So that's something that we again think about a lot, try to do. Have we gotten it perfectly yet? No, I don't think so, but are we on our way? We believe so.
Yeah, I mean, that's a really creative, cool, fun idea, to gamify that onboarding experience in that way. And I would say, even though you're humble, and of course no one's perfect, a lot of this to me, and I'll point to you mentioning Amazon, or we could mention Netflix, trying to turn healthcare into an experience like that to me sounds very much like the future of customer experience. And that's what we're here to talk about. That's what we've been talking about, if you ask me. But before I let you go, do you have anything you want to add when it comes to what you foresee in or outside of your industry, and maybe just how you would describe the future of CX?
Um, I hope in the future, CX is something every person thinks about, every person is able to do, every person is able to connect to. Um, uh, it starts with the mission. It's really about ensuring that your mission is something that's very clear across the organization. And CX comes in early and is at the table right from the beginning in the design stage. So it's not once you've designed your product, you're wondering what the experience of the customer is going to be. So you go out and get data. If you start it right from the beginning, then you've already integrated it in your design. So I think that's definitely where CX needs to go. I think it happens in some industries, but we need to do a better job of it in healthcare. I think we're trying to do that. I think, of course, with AI, of course, with machine learning, we're going to continue to be able to leverage customer facing tools that will really help us be better when we're talking to our customers, be better when we're serving our customers. We also want to be able to predict as much as possible customer behavior and anticipate any abrasions before they're going to happen, so we can solve for that experience before it's going to happen. So that's definitely an area that we're very eager to continue to get better at. And as you know, in healthcare, there's a lot of shift towards telehealth, towards moving to home-based care. We start looking at, what part do we play in that, and how do we continue to kind of not be one size fits all? Not everything would shift to home care. How do we manage a lot of these different set of expectations and ensure that we're still allowing for a level of personalization but efficiency in the way we're coming with services to our customers? Ultimately, the goal is that they're happy, they take care of themselves, and ultimately lead healthier lives. So that's what we're here to make happen. So hopefully, with MetroPlus, we can continue to do that for our customers in the New York City area.
Wonderful. Thank you so much. I'm not kidding when I tell you that I really enjoyed this and learned a lot. And I think that your peers, as experienced as they may be in their respective fields, can learn a lot as well. So thank you. And let's certainly do this again.
Thank you, Phil. It was a pleasure. Have a good afternoon.